Hi, good afternoon, everyone. Myself, Dr. Astha from Prudent Wellness team, and we are welcoming you all to join for today's session on a very interesting and a very important topic, skin and hair care. Everybody wants to look good. Everybody takes care of their fitness nowadays, and apart from the body, the whole look depends on how your skin and hair look and how you feel also about your skin and hair care. Skin and hair care also play a very important role in our human body. They act as a defense mechanism also. They prevent from various, it's the defensive mechanism of the body from various bacteria and germs at the first level. And to take care of skin and hair, it all depends on how you eat well and how you take care of the whole thing in a good way. So now in today's time, we see people are more careful about buying a lot of products to take care of their skin. They follow various kind of lifestyles and diets so that their skin looks good. And once you have a good skin and hair, the whole personality also changes. So today, for talking on this specific topic and a very interesting and an important topic, we have Dr. Mukta Sachdev with us on our session today. She is the head of the department for dermatology at the Manipal Hospital, Bangalore. Over to you, doctor. Just tell us a few more about yourself. We would like to know about yourself and your and about the skin and hair care people are following, because you dealing with them every day. You would be knowing more why and how people are taking care of their skin and hair nowadays. And it's the, I think, major part of the expense also. People are spending a lot on this part again. So just give us some good tips where we are able to take care of this very important part on a daily basis and in a very simpler way also. Over to you, doctor.
Thank you, Asta. Good afternoon, everybody. So I hope you all can hear me. Is that good, Asta? You can hear me? Am I okay? Great.
Yes.
Okay, so I'm Dr. Mukta Sachdev. As Asta said, I'm head of the Department of Derm at Manipal Hospital. I run a private practice. I'm a global key opinion leader for darker skin. I specialize in lasers, peels, skin consultations, clinical anesthetic dermatology. I present globally, written a couple of textbooks, etc., etc. But let's get to the session today. So we're going to talk about skincare and beyond. I'm happy to take questions. So if you can post them as we're going along, if I can answer them as we go along, fine. Otherwise, we'll do it at the end. But please do ask your questions so that it becomes interactive. So skin, hair, and beyond. We're in an era of looking good. So basically, it's pressure. It's high pressure. And if I had to tell you, where in addition to work pressure, you also now have media pressure. So let's take a look. I'm going to try and simplify everything for you. And then hopefully you'll go back with some sort of plan as to how you can manage. So basically, the skin is the largest organ in the body. The weight of the skin is 6 to 9 pounds and it stretches over 20 square feet. So it's effectively huge. It's your largest first line of defense against infection, and it protects you from injury. It regulates your body temperature and it regulates your fluid loss. So really the skin is very important. Now, men and women are starting to look after themselves at a much younger age. So really you want to look as good as you can for as long as you can. And skin nutrition is external and internal. What's your end game? I think the moral of the story is that you need to take care of your skin and your hair. You've got the outer layer and you've got the inner layer. And what I see now is most patients come in, they've been on Instagram, they've been on social media, and they come in with these bags of products and they actually tell me the layers of the skin. So the real layer you're concerned about is your stratum corneum. That's the surface of the skin. It is dead and it's the protein layer and it can be seen and felt. but it's very difficult to penetrate deeper than the stratum corneum. So now, if you have to outsmart your skin's care cells, how do you follow a great skincare routine? So total nutrition, you've got the external vitamins which you need, and you also need internal vitamins. So you've got a water intake, you have nutrition, you have healthy, balanced diets, multivitamins, and of course, exercise. These are things you should be taking care of. What about externally? So what is your nutrition for the skin? What are the vitamins for the skin? And this regimen which you adopt needs to be flexible. You need to change it depending on your age, whether you're premenstrual, whether you're perimenopausal, whether you're pregnant, whether you're feeding, whether you have a lot of outdoor activity, whether you are a trekker or you're cycling on weekends or you're in front of your system 24/7. So your skincare needs to be modified. There are a few booster products. These are skincare products that you need to integrate into your skincare routine, namely vitamins A, C, and E. Now, C and E work very well in preventing pigmentation, brightening your skin, and giving you a glow. Vitamin A is the retinol, and that's the use of retinol or vitamin A can actually result in smoother skin, more youthful skin, and an increase in collagen and elastin fibers. So we're going to put the vitamin C and E together. I would like you to use a vitamin C and E product, and that will regenerate, it'll prevent against damage, it'll brighten your skin, it'll clear your skin. Why do we add the vitamin E? Because it's an emollient, it's a moisturizer, and it's an antioxidant. So it'll protect your skin. Lots of my patients are using herbal extracts, they're using botanicals, and most of the skincare products say natural. And so, yes, natural products work. They are purportedly having less side effects, but nevertheless, you have to check that these natural products have been tested. And a lot of the time, the natural products are purely not natural. They are combined with chemicals which are used for skincare. Now, if you look at your own, yeah.
I have got a few questions if you like
Please,
to take
please,
in between.
please. Yes, yes.
So, one first question is, I have strawberry skin, specifically the arms. How to deal with it? I'm currently living in Bangalore. What is the best way to deal with the hard water?
Okay, so that's three different things. Hard water doesn't cause strawberry skin. When you say strawberry skin, that's something called keratosis pilaris, which is the bumps on the arms and the legs. So that can be dealt with a keratolytic cream. That's a moisturizer with urea. Hard water, I mean, honestly, hard water has not been proved to cause a lot of problems, especially it doesn't cause hair loss. There's no study documenting that. But hard water doesn't feel great on the skin. It can dry the skin. So therefore, you should use a water softener. You get portable water softeners. You get, if you're in a house, you get a softener that can be added in the apartments. So that's how I would deal with it.
Next question is, I have dots on my back. My doctor suggested acne body spray. Is this good?
Acne body spray is, I don't think that's a brand. You're asking product recommendations. If you have acne on your back, we use medicated acne solutions like clindamycin, and that works well for acne.
Okay, doctor, thank you. Next question is, due to vitamin D deficiency, I expose myself to sun in the morning around 10:30 for 15-20 minutes. Will this cause any skin issues or graying of hair?
Okay, so if we're going to get into each and every condition, then honestly, that's going to take some time. But yes, I will answer this one. So excessive sun does not improve your vitamin D. They have found that your vitamin D is largely related to dietary deficiencies. So whether you stand in the sun for 1 hour or 10 hours, it's not going to improve your vitamin D vastly. You will need a vitamin D supplement. Most of the Indian population is vitamin D deficient. A farmer who stands in the fields all day is still vitamin D deficiency, exhibiting that. So it has been shown that as a nation, we are D deficient, and that is more because of our dietary deficiencies. Graying hair, premature graying, very hard to deal with. It is genetic and not caused by any sun exposure or vitamin D deficiency. Okay.
Thank you, Doctor. We can move with the question. Yeah, we'll take the question.
Sure. So we have 6 skin types. Excuse me. I'm not going to get too much into depth, but suffice to say then numbered 1 to 6, and the first 1 to 3, the first one is obviously the Caucasian foreign skin. And as we go darker to number 6, it is the African skin. And in between, so that is 3, 4, and 5 is the predominantly Indian skin. And that's what we refer to as skin of color. Now, when you have darker skin, you are protected by melanin. So your skin will be smoother, stronger than the Caucasian skin. What I mean by this is if you look at somebody who's a fair skin, white skin, Caucasian skin, at the age of 60, and you look at a 60-year-old Indian skin, they will look significantly different. So we age better because the melanin is protected. That being said, the use of sunscreen is required just as much in darker skin. So just because you have dark skin, it doesn't mean you don't use sunscreen. Darker skin also tends to be more dry, and therefore your skin routine needs to be modified accordingly. So basic question for all of you is to find out whether your skin is normal, dry, oily, or combination. And that's the first step. So what is normal to dry? Normal to dry is when your skin feels tight, you have dull, flaky, dry patches, you have fine lines which are more apparent around the eye or near the lips. Your skin is usually clear from blemishes. You may feel sensitive in cold weather, dry heat, or hot climates. Normal to oily skin is when the skin looks slightly more shiny, especially in the T-zone, that is your forehead and nose. Your skin feels a little more greasy to the touch. Your pores may be more visible, and you're more prone to breakouts and blemishes. So all skin, whether it is oily or whether it is dry or whether it is combination, the skin needs hydration. The bottom line is not all skins need the same amount of hydration. Oily skin needs less and may not need it in certain spots or pimple-prone areas. So if your skin feels tight and dry when you wash, then you need to use a moisturizer which boosts your skin by preventing water loss and keeping your skin soft. If your skin is oily, you will use more of a gel-based moisturizer. If your skin is dry, you will use a cream-based moisturizer. So what's your minimum? Now, this is very important because everybody's trying loads and loads of products. So what is the minimum you should be doing? You should be using a face wash in the day, a moisturizer, an eye cream, and a sunscreen with a minimum SPF of 30. Some of the creams have a 15 plus, but out of choice, minimum SPF of 30. Your night routine, a face wash, an eye cream, and a night cream. So this is the basic. Everybody needs to be using this. What differs is the choice of product. So let's say you have very dry skin. Let's go back to this. You've got very dry skin. So you use a creamy moisturizer. You use a very gentle face wash. You use a good sunscreen, which is again a cream base. If you have oily skin, you'll use a face wash suited for oily skin. You'll use a gel-based moisturizer, and you'll use a light gel or fluid sunscreen. So what I'm trying to emphasize is that you need the products. It is your choice of products you've got to be clever about. Coming to a bit on hair. Now, hair is made up of keratin or dead cells. Okay, this is what your hair looks like. What are your factors? Again, factors are nutrition, chemicals and dyes, environment, UV pollution, medical conditions such as anemia, thyroid, if you're on any other medications. The big thing here now is COVID. If you've had COVID, if you've had dengue, if you've had H3N2, viral, any of those, you can have a lot of hair fall, and that needs to be managed. It is usually reversible. It settles down in 3 to 6 months. And most of the time, we just do a basic blood screen to check. Sunscreen. Everybody comes and tells me, I don't need sunscreen. I'm a tech professional. I'm sitting in front of my computer all the time. You do need sunscreen. You do need to protect yourself. The sunscreens really absorb UV rays. The sunscreens protect you against wrinkles, photoaging, tanning, and burning. So the SPF is basically an index of the amount of protection your sunscreen will give you. Always use a minimum of SPF 30. Even in skin of color or Indian skin, an SPF of 30 is what you want to do. So now it's time to change. If you're excessively stressed, you'll find your skin changes. If you're going to Goa on vacation, you need a higher SPF. You need a more fluid SPF. You've got to reapply your sunscreen 3 or 4 times a day. You need to make changes. You need to wear a hat. You need to moisturize. Every season, you may need to modify your skincare. You may find that in winter, your regular skincare just doesn't work. So you have to modify it. Even though you have oily skin, you may be excessively dry in December. You need to change. As you get older, so if you're 20 to 30, your skincare is very different from a 40-year-old who is perimenopausal, or if it's a male patient undergoing a little bit of hormonal change and you're aging. So your skincare has to change every decade because your skin will start showing the visible changes. So let's look at some choices of products, or what can you use. And I'd like to put here natural ingredients. So everyone who comes into my office always says, I'm using either, I don't know, anything from curd to watermelon to tomato to anything in the kitchen to put on their skin. Natural ingredients. Everyone loves the word natural, but you've also got to make sure it doesn't harm your skin. If you put, I've seen people burn their skin with a combination of lime and turmeric. So you have to be careful what you're putting, because just because it's natural or it's found in the kitchen, it doesn't mean it will not harm you. So a lot of the time people use rose water, glycerin, haldi, nimbu, lime. And then because we're in a very busy schedule, sometimes they'll just put it all together and they'll add it and they'll put it on their face. So natural ingredients can also be harmful. Use them with caution. So this is what natural ingredients did. They burned the skin of one of my patients. And here, this patient put toothpaste on her pimples. This is a very common thing, that people put toothpaste on pimples and it burns their skin. So do be careful. Let's talk a little bit about acne. Now, acne is the medical term for pimples. Okay, pimples are usually hormonal. In women, they're related to the menstrual cycle. And a lot of the time we do certain blood investigations and we look for what we call polycystic ovarian syndrome. This is very common today in young adult females, and this is often the cause of their pimples. A little bit on acne here. So you should not squeeze or pick a pimple because you will get scars there. It's much better to use a medical dermatology recommended gel, which will dry the pimples. It may fade, leaving a very faint mark, which we can fade away. But if you pick it or squeeze it, you will cause a certain amount of scarring. And that's much more difficult for us to get rid of. If you're sitting in the office all day, which I am sure a lot of you are, there are lots of problems related to just general office work and behavior. You're in a corporate environment. You're sitting in the AC all the time. That can dry out your skin. So your skin becomes very parched and dehydrated. How do you remedy that? So if you can splash water a couple of times, there are some very nice thermal water sprays available. You can keep it next to your workstation and just spritz your face so that your skin hydrates. And definitely in the afternoons, go wash, reapply your moisturizer. If you're traveling a lot, carry your skincare with you. Make sure you do reapply. The flights dry your skin, the different climate changes dry your skin. In the washing facilities where you wash your hands, your bathroom facilities, they have very harsh detergents. You'll find that your hands really dry out a lot. So it's always good that you take care of your skin and prevent against this. And especially with COVID and the use of sanitizers, that's become a big problem and people are getting allergic to that. Remember, hydrate. Hydrate through the day, drink plenty of water. The external hydration will give you skin hydration. A quick tip here is to keep a small skincare bag in the office. The miniature face wash, sunscreen, moisturizer, hand cream, this water spray, make a little pouch. Keep it in the office and just take 5 minutes for yourself during the day. Personal grooming. Now, this is something we see in the office a lot. Everybody's dressing up, lots of makeup, lots of camouflage, and how much is too much? So try and keep a simple routine, make it easy, make it something you can do daily. And makeup is not harmful. You put it on top of your sunscreen, and the idea is that you must remove your makeup at night. Use a good makeup remover, cleanse your skin, moisturize your skin at night. Technology dermatitis. How do you protect your skin from the laptops, from the systems? We have defined conditions related to technology. We've got cell phone dermatitis, we have toasted skin syndrome, and we have skin sensitivity from too much radiation. You've all heard of the blue light damage to your skin, and this can cause dryness, premature aging. So too much use on the cell phone, use headphones, don't keep the phone to your cheek. We've seen burns, we've seen pigmentation, we've seen ear burns when the phone is on the ear all the time. If you keep your laptop on your thighs, you can get toasted skin syndrome, and that is where you get discoloration and burning on the front of both your thighs. And obviously, this can be protected if you use hands-free, you use screensavers, you spray your skin, and you use sunscreens. Any questions, please do post them, or let's take them as we go along. I get this a lot from patients who walk in. Can we use deodorants? Can we use antiperspirants? Now, obviously, personal hygiene is very important when you're interacting with everybody. A lot of people complain of underarm pigmentation, irritation, itching from the use of deodorants. There is a clear-cut difference between deodorants and antiperspirants. So antiperspirants will help reduce the odor from sweating. If you just spray a deodorant, it smells nice for a while, but after a while, the odor or the body odor mixes with that and it really doesn't smell pleasant. So choose an antiperspirant over a deodorant. We have lots of people getting married, wedding season's in, and everyone thinks that henna is natural and doesn't cause irritation. But we are seeing a lot of irritation, and especially from people using the temporary henna, which has got PPD added to it. So when you're in Goa and you want that tattoo on the beach side, this is the reaction you can get. And we've seen quite bad reactions. This is from a simple beach tattoo. It is an irritant dermatitis to the henna because they add what we call PPD, and it makes it darker initially, but then it burns the skin. Okay, so this is from a tattoo. A lot of people wear the wedding bangles, you know, and I know that I think I'm speaking to a lot of the younger audience here, and people get allergies to things like this. So keep an eye on your skin, because otherwise you can get pigmentation which doesn't settle. So it's very tempting to do beauty treatments, and sometimes very excessive. So when you use too much bleach, you can actually burn your skin and get flaking, which then can lead to pigmentation. So be careful. Parlor problems, obviously, a lot of the hygiene, the quality, the expiry dates of products, you need to be wary because we had a 3-year hiatus with COVID. So there's a lot of expired products out there. It's becoming a little bit of an issue sometimes. From skincare product choice, you've got shelves of products, the internet, Instagram has got hundreds of products, and it's very confusing on what to buy. So if we had to make a choice, we'll try and help you choose your ingredients. So let's have a look at what you can choose from. So as I mentioned, you can choose a vitamin C for an active, you can choose a retinol for your anti-aging, and you can use hyaluronic acid as your moisturizing agent. Retinol should not be used in pregnancy and breastfeeding, and it should not be used excessively around the eyes and the mouth area because you can get a lot of dryness. We have a lot of exotic ingredients. I have patients coming in using snail essence, snake venom, emu blood, caviar, gold, silver, pearl, eggshell, all of these exotic ingredients. A lot of them don't have science behind them. So you need to look at what the proof is that these ingredients work. So now I'm going to take a few myths and facts. I hope this will cover a lot of your commonly asked questions. So the first one, the first myth, my skin is oily, I don't need any cream. So we've dispelled that. Everyone needs cream. Remember, your type of cream is what is important. Remember to moisturize your face, your hands, your neck, your body. Choose the cream carefully. So listen to your skin. And as I said, if it's oily, a lighter moisturizer or a gel. If it's dry, you use a cream base. Can I use the same product all over my body? So different areas of your body are exposed to different stimulants. The face is exposed to UV, so therefore you need something with sun protection. Your hands are exposed to frequent detergents, so you need heavy occlusive moisturizers. Your body is exposed to soaps and washes and therefore needs a different kind of moisturization. So it's ideal to choose different products for different body areas. So your product choice is important. Some people come in and say, I'm just using baby cream, or I'm just using XYZ cream. I've been using the same cream forever. By using a harsh cleanser and not using proper moisturizer, your skin actually tries to produce more oil, and then it becomes a vicious cycle. So stay away from very heavy or oily moisturizers because they can make you feel uncomfortable. And if you've got oily skin, you can actually get acne. It's if you have excessively dry skin in the winter, then these moisturizers work well. Otherwise, choose the lighter moisturizers, and especially hyaluronic acid. It works very well. The face is more prone to acne than the body. It's going to have more sun damage and eventually can lead to being an extra dry area because of excessive cleansing. Don't forget to take care of your hands, your feet. People who have dry, cracked hands and feet, there are dedicated creams for these areas. And for body, you need something that's easy to apply. We've all got super busy lifestyles. So ease of application, a spray or a lotion is preferable. If it's a very thick cream, you won't do it because it takes time. Another myth everybody tells me is it's cloudy, I don't need SPF. So the fact is, UV rays pass through the clouds, your skin gets damaged. Even if there is no sun exposure, you are constantly exposed to the rays. Okay? According to the Skin Cancer Foundation, 80% of the sun's rays penetrate the clouds. Bottom line, apply your sunscreen, reapply it every 2 hours, whether you're in the office, whether you're swimming, whether you're sweating, and your sunscreen and your SPF protection are really your best tools for anti-aging. This is one I get a lot. Anti-aging cream doesn't work. So, people come in and say, I've been using this anti-aging cream and it's just not working. It's not showing improvement. So a lot of the time it is showing improvement, but you forget that you are aging, okay? And this is a constant. So look for the active ingredients like I've told you, combine with sunscreens. Sometimes you need procedures for anti-aging. And of course, happiness reflects on one's skin. So the anti-aging creams can only do so much. They've got their place in your routine. But if you're smoking, you're drinking, you've got excessive stress, you've got a lot of diet issues, then obviously you need to take care of those aspects. Another lot of patients come in saying, I won't use anti-aging, my skin is oily. So what is the fact? for men especially, your oily skin needs cleansing and it needs anti-aging. Choose a serum versus a cream. And as you get older, women generally, they don't have such oily skin. As one matures, your skin is drier and needs more hydration. So can you scrub or should you scrub your skin? That's what we call exfoliation. Exfoliation or scrubbing the skin can be beneficial for oily skins especially, and if done correctly. Scrubs, microdermabrasion, it can be harmful if your scrubbing is excessive. So not too vigorous, frequency once, twice a week, depending on your skin type, and darker skin tends to pigment if your skin is scrubbed too much. Any questions so far before I get on to fairness? Asta? No?
Yes, we have questions.
Do you want to take some?
Yes. One question is, how should one take care of hair when having a dry scalp and a lot of dandruff?
Okay, that I'm coming to. We're covering hair in a bit. What else?
Question
And anything
is,
else?
good hair mask is good for hair, and can you suggest any one hair mask?
Okay, I'll cover those. So let me just then run through this because we're coming to hair and hair spas, etc. So I'll take care of those questions. Okay. Okay, so skin of color, fairness. Everybody's using fairness creams. Now, this is very controversial. It's very cultural. As a professional dermatologist, we don't like the word fairness. We look for even tone, glow, radiance, but we don't look at fairness anymore. And even if you've seen the multinationals, it's not Fair and Lovely anymore. It's Glow and Lovely. So it's changed. The bigger companies have moved their language, so we don't want anyone trying to lighten their skin anymore. A little bit on spa treatments. So should you go for massages, facials? Do they help? They relax, they refresh, and they are very beneficial. I think they do very well. The only thing is your skin type. You need to choose your treatments based on your skin type. For the men in the audience, so some people say men are thicker skinned than women, and actually it's true, at least in the literal physical sense. Women tend to have thinner, more fragile skin, while men build up a thicker outer covering. That's really the primary difference between the sexes as far as skin is concerned. Despite this distinction, the men's skin still needs just as much attention and care as a woman's skin. And the big problem is that most men don't know how to take care of their skin. Your everyday elements such as the sun, the wind, everything can hurt your skin. So even if you're a man, I need you to apply a moisturizer with sunscreen. We have great products which are moisturizer, sunscreen combined, and you can use this following shaving and it'll make your skin look much better and feel better. Instagram. Now, what has Instagram done to my life? Honestly, Instagram patients have product purchases, they're confused, the influencers are giving out some wrong information, and honestly, there's too much information, which is the upside and downside of social media. So I would really be cautious on what you buy on Instagram. Check first before just getting carried away and making your purchases, because I've seen a lot of sensitive skin post-pandemic due to this Instagram purchase. What has COVID done to the skin? So COVID has damaged the skin, the hair, and of course the psyche. I think that has been a real problem with COVID. There's been skin damage, there has been hair fall, hair loss, and this is where I'm going to get into your hair a bit. And psychologically, everybody feels they're not looking as good, they're not feeling as good. So now we're getting out of that slowly, but it's very important to address that and not overuse too many products. If I had to look at hair, now the big complaint that everybody has is hair fall, dandruff, and male pattern thinning or baldness, female pattern thinning or baldness. So what do we do for that? First, we find out the cause for hair fall, whether there's a nutritional deficiency, whether you've had a viral infection, etc. And then we give you hair nutritional supplements which strengthen the roots of the hair. How often should you shampoo? Basically, it depends on your lifestyle. I have people shampooing every day because they're working out, they've got oily, greasy hair. I have people shampooing 2 or 3 times a week. But ideally, once a week is not enough. So if you're doing once a week, you need to, with a healthy, active lifestyle, at least 2 to 3 times a week. If you have a lot of dandruff, then you need to use an anti-dandruff shampoo. We have varying degrees of anti-dandruff shampoos, and depending on how bad your dandruff is, we often combine 2 shampoos, one once a week and the other one alternate days, to help get it under control. There's been a huge amount of questions on oil and dandruff. If you have dandruff, oil is going to aggravate your dandruff. So you should not leave your oil overnight. If you really feel that you can't manage with oil, apply it for half an hour and rinse it off. But otherwise, don't oil and leave it in overnight. Hair spas, there are deep conditioning treatments or hair spas, and they work well when you do a lot of blow drying and hair treatments because your hair gets really damaged. So there are many professional hair spas which are available on the market, and you can just apply a mask for half an hour once or twice a week, and it gives you a nice deep conditioning. So you've got to remember that a commitment to a regular program of basic skincare and hair care for men and women is really the best initial step you can do. So we've got internal and external nutrition. And do remember that happy skin is in. You've got to be happy with your skin, and then you find that your skin really glows.
Thank you, everyone. Thank you, Dr. Mukta. The session was really great. I think people would have got their queries resolved, but I know there were a lot of questions still pending. We'll take it sometime other. But I would just wish everyone a very good and happy weekend. And we are at the last day of March, so start your skincare and hair care routine as shared by Dr. Mukta. Thank you, doctor. Thank you for coming and telling us the great information. I think awareness is something which is there and lacking. So we were hopeful that we made people more aware now. Any note for closing and any note to the people, to the audience from your side, Doc?
Yeah, I would just say have a happy skin day. Take care of your skin and have a happy skin day. Okay?
Thank you, Doc. Thank you so much.
Bye-bye. Most welcome. Bye.